Menarche. Many adolescent girls start their periods uninformed and unprepared. Mothers are the primary source of information, but they inform girls too little and too late and often communicate their own misconceptions. Menstruation is widely seen as polluting and shameful, and girls are often excluded and shamed in their homes. Educate girls about menstruation, create norms that see menstruation as healthy and positive, not shameful and dirty. Menarche, the first menstrual period, which occurs during puberty, is known by the medical term menarche. Menarche in a female adolescent is a marker of normal female reproductive health and wellness. The absence of normal menstrual periods, not related to pregnancy, is called amenorrhea. Menstruation is the monthly shedding of the functional layer of the uterine endometrial lining that occurs when ovulation is not followed by fertilization. Ovulation is the process in which a mature egg is released from the ovary. It occurs approximately every 28 days, with a range from every 21 to every 45 days. The average age of onset of menarche is 12.4 years. Most menstrual periods last between 3 and 7 days, and menses that last more than 10 days is considered abnormal. Menarche signals maturation of the adolescent female body. It is commonly associated with the ability to ovulate and reproduce. However, the appearance of menarche does not guarantee either ovulation or fertility. Before the girl gets her first period, you'll probably notice other signs of puberty, such as breast development. Many consider a girl's first period to be the first step towards womanhood. What is menstruation? It is a complex process during which your uterus sheds the lining of its inner wall, endometrium. Every month, your body prepares itself for a possible pregnancy. Getting your period basically means that you are not pregnant. Throughout the monthly menstrual cycle, your body uses hormones estrogen and progesterone to thicken your uterine lining. Composed of blood and tissue, it is crucial in assisting with the process of egg fertilization. If you don't become pregnant, your body no longer needs this lining and starts to break it down and expel it through your vagina. On average, the menarche age for girls in the US is around 12 or 13 years. The standard age range for menarche is between 11 and 15. However, young women can also experience early menarche, before 11 years, or delayed menarche, after 16 years. Some scientists speculate that increases in body weight during childhood account for the early onset of menarche. Early menarche is a symptom of precocious puberty, which could be the result of ethnic background and predisposition. Certain groups are more prone to early menarche. Central nervous system abnormalities, rare genetic syndromes, tumors of the brain, pituitary gland, or ovaries. Adrenal gland disorders, severe hypothyroidism. In contrast, delayed menarche is often attributed to a lack of body fat. Your body requires adequate amounts of fat to enter the phase of puberty and trigger your first menstrual period. That's why hardcore athletes, such as swimmers, dancers, and gymnasts, who tend to carry less body fat, are more susceptible to delayed menarche. Additionally, young women struggling with eating disorders appear vulnerable to this as well. Low adiposity can inhibit normal menarche, and it is estimated that a minimum body fat of 17% is necessary for menarche, with 22% body fat necessary for maintaining normal menses. The hormone leptin appears to have a role in the maintenance of normal menstrual cycles as well. Stress and obesity appear to be predictors of early menarche. Abnormally elevated adrenal androgens or insulin can affect normal ovarian estrogen production and decrease the normal pituitary production of luteinizing hormone. Menarche is the result of complex interactions between the hypothalamic, pituitary, and ovarian hormones. It also can be affected by the thyroid, adrenal, and pancreatic hormones. Thyroid hormones are necessary for normal menses, and their deficiency or excess can inhibit menarche or lead to abnormalities in existing menstrual patterns. Other possible causes of delayed menarche include genetic predisposition. Delayed menarche often runs in the family. Health issues such as inflammatory bowel diseases, IBD, anemia, diabetes mellitus, kidney disease, and cystic fibrosis. Radiation or chemotherapy treatment. Autoimmune disorders, Addison's disease and Hashimoto's thyroiditis. Tumors of the pituitary gland or hypothalamus, which affect hormone production. Primary amenorrhea is the complete absence of any menstruation by 15 years of age. Secondary amenorrhea is the cessation of menstruation for 3 months or more after it has started. In the first 2 to 3 years after the initial onset of menses, it is common for irregular cycles to occur, with adolescents often having several months of missed menses. Many of these irregular cycles may be non-ovulatory due to poor early regulation of the hormonal interactions between hypothalamic, pituitary, and gonadal hormones. Young women usually undergo initial breast development roughly 2 years prior to menarche. They may take several years to grow and will start out as breast buds. Other signs of puberty include hair growth in the underarms and pubic area. Lastly, before her first period, a girl will notice thick, liquid-like vaginal discharge that's white, clear, or yellowish in color. It's perfectly normal and helps the vagina to clean itself and fight off infections. Odorless discharge. Note that vaginal discharge should be odorless. A strong odor could mean a urinary tract infection. If a girl's first menstrual period shows up unexpectedly and there are no sanitary pads on hand, she can temporarily use folded up toilet paper. If her mother is not with her when it happens, ask a teacher, school nurse, or a friend for help. It's best for beginners to avoid tampons until they've read the instructions thoroughly and practiced a few times. It's essential to change a pad every 4 to 6 hours to prevent bacterial growth and infection. A girl's first period will generally last a few days, so she'll need to stash several pads in her bag. Remember to take note of the date that her first menstrual period begins so you can be better prepared for next month. Keeping track also allows you to detect irregular periods, which are especially common during puberty. Tips for managing a girl's first period. Carry sanitary pads or tampons at all times. Save thin panty liners for lighter flow days, as menstruation winds down. Expect lower back pain or abdominal pain, and consider using a hot water bottle to relieve achiness. Ease up on exercise and other strenuous physical activity. Drink plenty of water. Get a full 8 hours of sleep each night to battle fatigue. If a girl doesn't fall within the average age range for puberty and menarche, it could be a sign of other health concerns. It's wise to take her to the doctor if she's experiencing menarche before the age of 11, or if she's displaying any of the following symptoms. Delayed menarche, absence of menstruation by the age of 16, lack of breast development by the age of 13. A gap of 4 years or more between initial breast growth and menarche. Menarche typically occurs within 2 to 3 years after the Larche, breast budding. By age 15 years, 98% of females will have had menarche. An evaluation for primary amenorrhea should be considered for any adolescent who has not reached menarche by age 15 years or has not done so within 3 years of the Larche. Lack of breast development by age 13 years also should be evaluated. Median age at menarche has remained relatively stable, between 12 years and 13 years, across well-nourished populations in developed countries. Girls who have been educated about menarche and early menstrual patterns will experience less anxiety when they occur. Typically, adolescent females who experience menarche are not ovulatory with every cycle in the first year. It is estimated that most will have ovulatory cycles within 5 years of menarche. Imperforate hymen is the most common congenital genital tract anomaly in females, ranging from 1 in 1,000 to 1 in 10,000 in prevalence. It can be noted at birth, as the estrogenized hymen in the newborn is often readily apparent. The absence of a normal uterus or vagina, due to Mullerian agenesis or Mayer-Rokitansky-Kuster-Hauser syndrome, has an incidence of approximately 1 in 4,500 females and often is not diagnosed until a patient presents with the absence of menarche. Hormonal abnormalities. Other complex hormonal abnormalities such as androgen insensitivity syndrome can present with external female development and primary amenorrhea. Abnormal development of female gonads due to Turner syndrome also can lead to ovarian agenesis and absent menses. Cycle length and ovulation. Menstrual cycles are often irregular during adolescence, particularly the interval from the first cycle to the second cycle. Most females bleed for 2 to 7 days during their first menses. Immaturity of the hypothalamic pituitary ovarian axis during the early years after menarche often results in an ovulation, and cycles may be somewhat long. 90% of cycles will be within the range of 21 to 45 days, although short cycles of less than 20 days and long cycles of more than 45 days may occur. By the third year after menarche, 60 to 80% of menstrual cycles are 21 to 34 days long, as is typical of adults. Abnormal uterine bleeding. A number of medical conditions can cause abnormal uterine bleeding, characterized by unpredictable timing and flow. A long interval between cycles is common in adolescence due to anovulation. Anovulation happens when an egg, ovum, doesn't release from your ovary during your menstrual cycle. It is statistically uncommon for girls and adolescents to remain amenorrheic for more than 3 months or 90 days. Girls and adolescents with more than 3 months between periods should be evaluated. Mean blood loss per menstrual period is 30 ml per cycle, and that chronic loss of more than 80 ml is associated with anemia. But this has limited clinical use because most females are unable to measure their blood loss. Menstrual flow requiring changes of menstrual products every 1 to 2 hours is considered excessive, particularly when associated with flow that lasts more than 7 days at a time. Abnormal uterine bleeding may be caused by ovulatory dysfunction. Bleeding patterns can range from amenorrhea to irregular heavy menstrual bleeding. Ovulatory dysfunction is somewhat physiologic the first few years after menarche. It can be associated with endocrinopathies due to hypothalamic pituitary ovarian axis disturbances. They include polycystic ovary syndrome and thyroid disease, as well as mental stress and eating disorders. Heavy menstrual bleeding, commonly associated with anovulation, also has been associated with the diagnosis of a coagulopathy. Coagulopathy is most typically defined as impaired clot formation. They include von Willebrand's disease, platelet function disorders, and other bleeding disorders. They may also indicate other serious problems, including hepatic failure, and, rarely, malignancy. The diagnosis of pregnancy, sexual trauma, and sexually transmitted infections should be excluded. Even if the history suggests the patient has not been sexually active. Abnormal uterine bleeding. Causes of abnormal uterine bleeding in adolescent girls. Pregnancy, immaturity of the hypothalamic pituitary ovarian axis. Hyperandrogenic anovulation, polycystic ovary syndrome, congenital adrenal hyperplasia, or androgen-producing tumors. Hypothalamic dysfunction, eating disorders, obesity, underweight or significant fast weight loss, or stress-related hypothalamic dysfunction. Hyperprolactinemia, thyroid disease, primary pituitary disease, primary ovarian insufficiency. Iatrogenic, secondary to radiation or chemotherapy, medications, hormonal contraception or anticoagulation therapy. Sexually transmitted infections, cervicitis. Malignancy, estrogen-producing ovarian tumors, androgen-producing tumors, or rhabdomyosarcoma, uterine lesions, menstrual abnormalities that may require evaluation, menstrual periods that have not started within 3 years of Menarche, have not started by 14 years of age with signs of hirsutism, abnormal growth of hair on a woman's face and body, have not started by 14 years of age with a history or examination suggestive of excessive exercise or eating disorder, have not started by 15 years of age, occur more frequently than every 21 days or less frequently than every 45 days, occur 90 days apart even for one cycle, last more than 7 days, require frequent pad or tampon changes, soaking more than one every 1 to 2 hours, are heavy and are associated with a history of excessive bruising or bleeding or a family history of a bleeding disorder. Remind your girl not to worry about when friends begin to menstruate, or if their periods seem different. Menstruation, including cycle length and flow, varies from person to person and sometimes month to month. It's also common for teens to have irregular periods. It might take 6 years or more after your period starts for your cycle to become regular. The average menstrual cycle lasts 28 days, counting from the first day of one period to the first day of the next period. Although cycles in young teens can range from 21 to 45 days, longer cycles are more common for the first few years after menstruation begins. Schedule a medical checkup if your child hasn't started menstruating by age 15 or within 3 years of the start of breast growth, or breasts haven't started to grow by age 13. Goes 3 months without a period after beginning menstruation or suspects pregnancy. Has periods that occur more frequently than every 21 days or less frequently than every 45 days. Has periods that become regular after having been regular, has periods that last more than 7 days. Has severe pain during periods, is bleeding more heavily than usual or using more than one pad or tampon every 1 to 2 hours. Suddenly gets a fever and feels sick after using a tampon,